Hi everyone, my name is Kai from Workwell, your personalized workplace wellness strategy consultant. We are a team that's focused on helping to keep you guys, the employees, happy and healthy. So on behalf of our team at Workwell, a huge thank you shout out. Wow, currently 101 who have actually just joined us this Saturday afternoon. So great recent news is that, we'll be out of the heightened alert phase very soon. I'm sure a lot of us are very excited. But we hope that everyone continues to stay healthy and safe, yeah? So we are very excited to bring you loads of value this afternoon. So let me quickly introduce our panelists for today. First up, it's one of my very, very close friends, Leslie Koh. You all might know him as the rice cooker man on social media. He's also a senior consultant at Prudential for the past 11 years. Yo, Leslie.
Hey, hi guys. Hi, yes, great to be here today.
So the next panelist is the reason why we all are here today, right? He's already turned his camera on. We both have the same surnames, but the difference is that he's the doctor, I'm not. So we're very honored to have with us today, Dr. Adrian Chan, consultant respiratory physician from Mount Elizabeth Novena Hospital, So he's actually going to help us dispel some of the myths surrounding the COVID-19 vaccine and help us understand the realities of it better as we wait for our turn to be vaccinated. I'm actually quite excited because my turn is going to be in July. I registered for it yesterday. So hi, Dr. Chan.
Good afternoon, everyone. Good afternoon.
Yeah. So before we begin, right, just want to actually give you a highlight of the event format so that you know what to expect, all of you. Shortly, I'll actually pass the stage to Dr. Chan. Prior to this webinar, right, we actually had an overwhelming response of questions, from you guys, close to about 50 over questions actually. Many of them are somewhat similar. So what we actually did was that we consolidated the top questions and, for the first 20 minutes, Dr. Chan will actually spill his wisdom on those common concerns surrounding the COVID-19 vaccination. All right. Then after that, Leslie and I will actually come back for further Q&A. This is also where we, help to actually surface any of the further questions that you actually might have. They are not, covered in the first part. So if you wish to actually chime in, there is actually the, Q&A chat. Please actually type in the Q&A chat in the Zoom section. Yeah. So that's where, we will actually, of course, try to cover as many questions as possible, but we do apologize in advance. There's going to be about 200 over of you. So very obviously, we won't be able to cover, personal type, personal consultation type of questions. And we wish to actually respect everyone's time. All right. So very, very, very last housekeeping reminder for your best viewing experience. If you haven't done so, you may want to actually switch your viewing mode to gallery mode. You can actually do this by clicking on the view at the upper right corner of your Zoom screen. Yeah. Okay. This will allow you to actually see all our panelists at once. All right. All right. So with that all of the way, Leslie and I will actually go on mute now and have Dr. Chan take the stage. Dr. Chan, take it away, please.
Thank you, Kai and Leslie. Right. Let me share my screen first. Right. Can you all see my screen? Okay, great. Thanks. And so once again, a very good afternoon to all of you. I really appreciate all of you taking some time out to perhaps hear me talk a little bit about the facts and myths of COVID-19 vaccines. I think since January, when the vaccines were rolled out, already we were getting a lot of inquiries, not only from the public, but also from healthcare staff about, the facts and the myths of COVID-19 vaccines. I think after several rounds of guidance from the ministry, from the government, it is about time. And I think majority are going to receive the vaccine eventually. It's about time that we collate what we know so far about the vaccines and help to clarify any doubts accordingly. So I would like to say that I have no disclosure for this presentation. As what Kai had mentioned earlier, I do apologize in the interest of time and for the discussion to remain objective. I do apologize. I won't be able to clarify any anecdotal or personal experiences, views, or consultations about the vaccination. What we are trying to do today is what you have perhaps read from the press or heard from your friends, for example, or perhaps off the internet, and you're not sure exactly how it affects you or how it affects Singaporeans as a whole. And that's what we're here today to talk about and to discuss further. Right. So I think first up, I would like to say that about 1 week ago or 1 week plus ago, Workwell actually sent me a list of questions that had been probably a list of questions that the early birds of this participants had actually posed to us. And I will tell you upfront that all the questions that were raised, these 10, 11 questions, were extremely relevant. In fact, some of these questions actually set me thinking, and actually I had to go back and do my own research of medical journals to try and come up with good answers and to convince myself, in fact, and perhaps all of you, that the vaccines are helpful in one way or another, and perhaps to address some of the concerns. So I think one of the biggest questions that has come up is actually about efficacy of the COVID-19 vaccines. There are many vaccines out there. So as you all are aware, there are 2 vaccines in the national program, those coming from Pfizer and Moderna. But how about the rest? Why did our government select these 2 vaccines? So we're going to talk a little bit about this. And the first question is, Pfizer is said to have 95% efficacy, Moderna is 94%. Does that mean that Pfizer is more effective, or does it depend on the individual's immune system? Right. And the next thing is, okay, so 95% efficacy. Does that mean I only have 5% chance to be contracted with COVID? Very relevant question. Let's look at how this magical 95, 94% actually came up. Now, I believe that this crowd is a very interested crowd. So what I'm going to share is actually some of the literature, the evidence from all the big medical websites, the journals, the ones that we look up to, all right, for guidance, for evidence per se. So this is the cold hard truths, and nothing from expert opinions or anything. So first up is basically the efficacy. Now, I've quoted this from New England Journal of Medicine. This is one of our biggest medical journals, right? And so this magical 95% actually came from this. If you look over here, right, on the right of the box over here, 95%. Now, how did this come about? Now, I will tell you that for the mRNA vaccines, specifically for Pfizer and Moderna, these employed very big clinical studies. So these were what we call phase 3, or just one phase of the study just before it is launched into the general population per se. And they got nearly 40,000 patients to participate in the clinical study. Now, in case for those who are not aware, a phase 3 study that involves 40,000 patients is massive. Normally, a phase 3 study can be a few hundred patients. That's considered very good already. So clearly, in times of need, they were able to recruit 40,000 patients. So from there, we can have very good data. And you can see that this is the name of the medical name of the Pfizer vaccine, okay, versus placebo. Placebo is basically injecting something that has no effect on, or some would say is basically injecting just a liquid with no medicines inside, with perhaps a little bit of water, which will definitely not generate any immune response or clinical reaction. So you can see out of these 40,000 patients were roughly divided into 2 groups. Out of the group that had were vaccinated, about 8 of them suffered COVID subsequently. And those who were not vaccinated, about 162 suffered COVID. So this 95% is basically comparing between these 2 groups, right? And that's how this 95% came up. This population was actually in USA. This clinical study was done in USA per se. So it does not 100% apply to Singaporeans, and I need to highlight that it's comparing 2 groups within the study itself. And this is the data from Moderna, came out slightly later. So same thing, comparing those who were injected with the Moderna vaccine versus placebo. And it's roughly about 93% compared to the placebo. So it's 93%. How do we exactly interpret this? So vaccinated people who had a 93 to 95% lower risk of getting COVID-19 compared with the control placebo group who weren't vaccinated. Now, if you extrapolate this to the general population, the actual percentage of vaccinated people in the Pfizer and Moderna trials was actually much less, 0.04%, very little, all right? Obviously, this the data comes from USA. Can it directly apply to Singapore? Probably not, but it is a good representation. So these are the numbers, all right? This 93, 95% refers to the USA population per se. In Singapore, it may even be of higher protection because our incidence of COVID is lower. Obviously, if you put you did this study in a population where there is a high prevalence of COVID-19, the efficacy perhaps may be a bit lower. But I think for any vaccine, 93 to 95% efficacy is extremely good per se. Okay. Now, the other important observation that has come up is that this is definite, that the mRNA vaccines help to prevent severe disease and deaths. This is an update from the Pfizer website itself. Now, the studies were done until December 2020. So all these companies actually continue to do surveillance or monitoring of the outcomes or the effects of their vaccine. And the latest update was basically in March 2021. And the good news is that there's efficacy of the vaccine, all right, up to 6 months after the second dose. So you can see that there's even up to 6 months later, there's still very good efficacy. There's a very good efficacy against severe disease. Now, majority of patients with COVID-19, about 85% will have mild symptoms. About 10 to 15% will get severe disease. And this is the group that we are all worried about because they can potentially end up in high dependency, ICU. I myself have managed a few in ICU before, potentially can die. So what this has shown is that these vaccines help to prevent severe disease. And this is an important group that we must look at. So how about the other vaccines which reported lower efficacy? As of now, there are 6 vaccines in total that are approved by the World Health Organization. Obviously, in study or in production are up to 80 plus vaccines. These are as an example of some of the vaccines out there. I'm sure you have heard the AstraZeneca vaccine. You have heard about the Johnson & Johnson vaccine, Sinovac and Sinopharm, right? So you can see over here where my arrow is pointing, the efficacy of the vaccines do vary. All right, there's a variable efficacy, but does this mean that the rest of the vaccines are inferior, lousier? Not really, right? Because what we need to know is that a direct comparison of effectiveness between the 2 vaccines that we have now versus other vaccines, it can't be compared like apples versus apples, okay? And there's several reasons why. Number one, the incidence or prevalence of COVID-19 is different for different populations. When the mRNA studies were done, all right, this was done probably in June up to December. USA had in the early part, not so much COVID. They were really badly affected come in the 3rd quarter and 4th quarter of 2020 and up to early this year, all right? So it's different populations that were being studied. So really, we can't directly compare. Also, the mRNA vaccines, it is true that at that time, when those 2 big studies that I mentioned earlier in the New England Journal of Medicine, the different variants had not yet developed. But what I can say is that I'm sure that the big companies, the vaccine companies are continuously assessing the efficacy on the variants. And as I mentioned, different case definitions and populations. So coming on to the next question, this is an interesting question. If let's say I had unfortunately contracted COVID before, right, does that mean that I have natural immunity after that and therefore I do not need to take the vaccine, right? And also if I take the vaccine, will it have the same efficacy on me as on someone else who never had COVID? I think that's a good question because in Singapore, there is a sizable number of patients who have contracted COVID before, right? So I think this is a valid question. Do they still need to go for the vaccine? And the study that helped us to determine that, yes, we probably still need to vaccinate those who had suffered from COVID before came from Denmark. So Denmark was one of the first countries that actually did a widespread testing for their population. So about 4 million tests by 2020. That's fantastic, a population study. And this is from Lancet, another big medical journal that we all look up to. So what you can see here, again, sorry for the busy slide, but let me show you, focus on this row here, or where my arrow is pointing, on the age group and the estimated protection. Now, one thing that we know is that for those who are older, even if you have contracted COVID before, all right, the protection does not seem to last. And therefore, you can see that even, let's say, after you contract COVID, right, for those above 65, the protection is only about 47%. In the younger patients, yes, if you have contracted COVID before, yes, you do get about 80% protection, all right? But it's the elderly that we need to be worried about. Even if they have contracted COVID before, they still have a high risk of re-contracting COVID. Okay, so natural infection with SARS-CoV-2 protects against reinfection, yes, probably 40 to 80%, weaker in those aged 65 or older. As of May 2021, locally, there are 26 cases of reinfection. Right. So what is the guidance? What is the advisory from our ministry? A single dose of our vaccine can further boost the immunity from those who had COVID-19 infection previously. Right. So for those who have recovered, right, please still proceed to receive the vaccine. And one small tip is to wait at least 6 months from the date of infection before receiving the vaccine dose. Right. So overall, prior COVID-19 infection is not a contraindication to receive vaccination. I hope that clarifies the doubts for those who had suffered from COVID-19 previously. Please still proceed to get your vaccine. Another big area that we'd like to talk about is actually the safety and side effects. And that's really a big concern among many of my patients. In fact, the top concern rather than the efficacy, right? So I think this is to start off, a simple question. Can I tell the difference after taking the jab? Well, not really. Well, so the first up, let's compare between Pfizer and Moderna. So the vaccine dose is 0.3 mils for Pfizer and 0.5 mils for Moderna. I doubt very much anyone can tell the difference from there. The dilution and shelf life, all these are taken care of by the vaccination centers or the polyclinic per se, right? So the one thing is that Pfizer is approved for adolescents, all right, above 12 years, right? Whereas Moderna is only approved for the population above 18 years and above. One way you may tell whether you are receiving Pfizer and Moderna is the time interval, all right? So roughly speaking, Pfizer, the previous time interval was about 3 weeks, whereas Moderna was about 28 days, i.e. 4 weeks, all right? But now the interval is different, perhaps about 6 to 8 weeks per se, all right? So 6 weeks is the average interval now between the vaccines. Other than that, I doubt very much one can tell the difference. Even for the side effects profile, they're quite similar. So will the side effects allergies be different for both kinds of vaccines, and which age group has different higher chance of getting the side effects? So I've mentioned this already, side effect profile is similar, looking at the data from the 2 studies, right? In terms of severe allergic reactions, I think this is a major concern among many of my patients, especially for those who have suffered, who have a known history of anaphylaxis before. Anaphylaxis is the medical term for a severe allergic reaction. So if you have rashes and swelling, and in addition, you get breathlessness and or dizziness, all right, that potentially is a severe allergic reaction or anaphylaxis. But the good news is that for the Pfizer and the Moderna vaccine, it's actually a very low rate of anaphylaxis. So far from USA data, 47 cases of anaphylaxis, all right? So that's actually about 4.7 cases per million doses, right? And for Moderna, it's about 2.5 cases per million doses. So that's extremely low. It is true, personally, I think I've heard from friends as well as my own self, all right? The side effects tend to be more common after the second dose. And younger patients tend to report more side effects compared to those more than 65 and 60, more than 55 to 64 years of age. But this is not hard and fast. I think it really depends on each individual per se. Right. So what are the side effects? So the side effects can range from very mild chest discomfort, can range from very mild pain at the site of the injection, chills, body aches, a little bit of fever, headache, and for example, such as some what we call lymph node swelling. I personally had a lymph node swelling at the right side of my neck, but it was very transient, lasted for about a day or so only. And most of the symptoms can be treated simply with a Panadol or paracetamol per se. Now, another question that often comes up, if I suffer very significant side effects, does that mean that the vaccine is working very well in my body? Is that the case? To be honest, there is no correlation between absence and presence of the side effects, okay, and the vaccine efficacy. As long as you receive the vaccine, all right, regardless of side effects, you are likely to be protected by the vaccine. Okay. Right. So another concern, green light was given for vaccination was recently given to pregnant ladies or couples planning for pregnancy, which was not the case previously. Right. So what are those findings? What has changed? Why did our government, reverse this decision? And are there still any other risks that couples or pregnant ladies should know? Right. So I will share with you, I echo a little bit of our government's view that when the vaccines were rolled out in Singapore, we adopted a very cautious and observant stance per se. And if you can recall, we prioritized the different segments of the population to get vaccinated. So what started off, who got vaccinated first? If you remember, it was the elderly. And that's absolutely important because clearly they are at risk of severe COVID disease if they contract COVID-19. Those who are at the front line, so for example, like healthcare staff like myself or those serving at the borders, for example, they were deemed as frontline staff. All right, so they got vaccinated first. Then subsequently, different groups got prioritized. Right now, the group that's being prioritized are those who are school going between 12 to 17 years of age, right? And pregnant ladies have recently, based on the latest guidance, were recently approved to receive the vaccine. Right. So what's changed for this group, or what's changed for the other groups per se? And again, another big study just came out about 2 months ago, preliminary findings of mRNA COVID-19 vaccine safety in pregnant patients. Again, taken from USA, because USA, obviously, they were one of the first to get vaccinated, and being the vaccines studies were done mainly from there, they have gone on to look at the data for those subgroup of patients. And so what did we find? Now, if you look at this is a simple schematic diagram, no need to go into the details, but you can see the side effects between the vaccinated in the dark blue versus in the dark blue, those are the pregnant patients, versus light blue, those are the non-pregnant patients per se, ladies otherwise. And you can see that overall the side effects profile, not too much different, pretty similar, and this is regardless of Pfizer or Moderna. In terms of outcomes, were there any concerns of the vaccines on pregnant outcomes, neonatal outcomes? Neonatal means the newborn outcomes. The good news is that this is the registry. The registry actually captures the data for all these pregnancies. All right. Good news is that the incidence of outcomes, there's no difference compared to the published incidence for otherwise other pregnant patients in the times when there's no COVID. You can see that all these incidences over here, percentage, falls within the known published incidence. So good news, all right, for pregnant patients, they are safe to receive the vaccine. But nonetheless, some patients may be concerned. Right. So what happens is that the guidance have come up with an advisory that although pregnant patients can be vaccinated, please proceed to discuss the risks and benefits of vaccinations with their obstetricians. Now, if they happen that they receive the dose of the vaccine and they get pregnant after the first dose, no problem. They can go on to receive the second dose. Right. Now, what it is true is that vaccine efficacy was no different in pregnant women with potential benefits of antibody transfer to the fetus. This is a hypothetical observation. We still don't know yet, but largely speaking, we hope that this is the case where the antibody do get transferred over to the fetus, thereby protecting the fetus as well and the newborn as well. But what we have to acknowledge is that the long-term impact of the mRNA-based vaccines on the fetus remains unknown. Only time will tell. But so far, based on the literature or understanding of vaccines, we do not know of any vaccines that can cause problems in newborns so far. And how about infertility? Good news, no impact on infertility. And those who are breastfeeding or lactating can be vaccinated, do not need to worry about interrupting breastfeeding before, during, and after the doses of the vaccine. And I think now that we are vaccinating, I just decided to take this off, even though this was not one of the questions. But how about vaccination in adolescents? Why did the government recently approve vaccination in our 12 to 17 years old? So again, this is a Pfizer study. This is the medical name for the Pfizer study, right? And so what they looked at is that they compared for patients 12 to 15 years old versus those above 15, all right? Roughly speaking, the biggest group was the 16 to 25. And the good news, okay, compared to 16 to 25-year-olds, this was a non-inferior study. The efficacy was similar overall, okay? They did observe a bigger immune response among the 12 to 15-year-olds, right? Safety profile was similar. They did observe that the 12 to 15-year-olds required a little bit more antipyretic or otherwise paracetamol use, perhaps a little bit more chills, a little bit more body aches, all right? So something for the parents and the young ones to take note. But otherwise, good news, all right? They are able to receive the vaccine based on this evidence. Okay, another question on side effect. Is there a side effect is there an association between heart attack and stroke with people who have recently taken the COVID vaccinations? This has come out. I'm sure some of you may have come across social media where there was some concerns that some of the patients who had received the vaccine subsequently suffered from heart attack or stroke. Is there a correlation? The good news is that looking at the overall data from different countries, or rather, I will correct myself, different continents, there's no association between COVID-19 vaccine and heart attack or stroke. Major associations, such as the American Heart Association, this is the American Stroke Association, ESC is the European Society for Cardiology. They have all come out to issue guidances that that overall, all right, there may be a risk of cardiac and neurologic complications, but they are extremely rare, right? And the benefits of COVID-19 vaccination outweigh the potential risks per se, right? And case reports, this is with regards to two of the other, not directly with Pfizer or Moderna, but several of the other vaccines, such as Johnson & Johnson and AstraZeneca. There were rare cases of unusual blood clots associated with low platelets. Platelets are blood cells that help to form blood clots within our body, right? There were rare cases of blood clots in specific locations. But so far, these cases, again, are extremely rare. And the overseas authorities have issued advisories for these for us medical professionals, right, to keep a lookout should these vaccines be administered. Likewise, I think recently there was a concern of heart issues, all right? Myocarditis. Myocarditis is basically inflammation of the heart muscle. Pericarditis is inflammation of the outer lining of our heart. Our heart has got not only the muscle, but a very thin lining per se. All right. So there were some concerns about inflammation per se. So I think we are keeping a lookout for that. Likewise, just I think came out today in the press about 4 cases of myocarditis locally occurring in young males. Fortunately, all are stable. No significant or serious complications thus far. All right. So, but nonetheless, this is something that as responsible authorities and government bodies will do, is to keep a lookout. Right. So I'm going to end my presentation soon. Some have asked about, do I need to prepare anything before my vaccination? and what do I do after my vaccination? Is there any special precautions per se? Right. So some questions that have come up is, do I need to adjust my diet before and after the vaccine? Some of you say that, can I drink alcohol? Right. Vaccine will make your body heaty. Therefore, you're advised to take a more cooling diet. Is that true? How about exercise per se? Let's talk a little bit about the advisory again. All right. So it is true, you will probably experience more side effects from the second dose. So perhaps you don't want to do it on a day when you're very stressed or you have a lot of activities, right? And take time to rest. All right. Probably about 1 to 2 days after the second dose. It is best to avoid strenuous activities, alcohol, or foods that perhaps can cause rashes, because you don't want to confound the clinical presentation. And otherwise, you can take simple antihistamines. All right, these are anti-allergy medications, right? If needed for itch per se, right? But otherwise, no major precautions, special precautions per se. Diet-wise, well, apart from those that may cause you to have allergic reactions, otherwise, heaty, cooling foods, I don't think that it makes a major difference. So the final question, I think this was given to me probably more by Workwell itself. Is there any take-away message or take-home message? Well, I think the key point about vaccination is really to protect yourself and your loved ones, especially if you have elderly patients, all right? And if we are able to vaccinate a larger proportion of Singaporeans, or perhaps achieve a very good percentage of protection in our population, all right, then what happens is that we can protect ourselves and potentially carry on with lives thereafter, right? So with that, thank you very much. I'll be happy to take questions.
Thank you so much.
Yeah, thank you,
Dr. Chan, for your slides. Yeah.
No problem.
Leslie, go ahead.
Yeah, so I have this question. So I like to eat a lot. So this is very allergic to me. So, like a lot of because we're also seeing a lot of questions about allergies as well, right? So we got allergies,
Yes.
like like medication, food, dust, environment, right? And it's always you mentioned that actually I've seen also reports that if you have mild allergy, right, it's actually okay for you to take the vaccine. Where people with severe allergy may not be able to take the vaccine. So the question that I have in my mind is, how do you define what is severe?
Okay.
Yeah.
Okay. So I have to, I will break this question down into 2 points. So to answer your question, what is considered a severe allergic reaction? I think I briefly mentioned during the talk that a severe allergic reaction is quite classical after you take a certain food or certain medication, or sometimes it can happen without any specific reason, rarely. And it's a combination of symptoms. If you just get rashes, the classic allergic rash is called hives or 风膜, right? Chinese like to call it 风膜, right? So if just plain rash or perhaps just mild swelling of the eyes, all right, that is not anaphylaxis. Anaphylaxis is when perhaps you have rashes, swelling. On top of that, you get breathlessness. Your breathing becomes noisy, because what happens is that the swelling now involves the airway. It closes off the airway. That's a danger signal. If you have giddiness because your blood pressure has dropped, that's a danger signal. Right? So those symptoms, together with the rashes or the swelling, that to me means a severe allergic reaction.
I see.
Yes.
So if someone who sorry to cut you.
No worries.
I saw someone actually ask this question, so which it goes in line with what the question I'm asking. So if someone has the history of the anaphylaxis,
yes, anaphylaxis, no problem.
Yeah.
Yes.
So in this, will you advise someone to go for vaccine if they have the history of this happening?
Excellent question. Now, I didn't cover this in my slide because I'm sure some of you were rejected previously. Some of the audience may have been rejected previously if they had suffered from anaphylaxis. Now, as I mentioned, the government was taking a cautious stance since the vaccination program was introduced. And what happened was that patients with anaphylaxis or allergic reactions to any vaccines were advised to hold on, don't get the vaccine first, right? The good news is that, again, from other studies worldwide, they have actually administered the vaccines to such patients. That means patients who had a history of anaphylaxis or severe allergic reactions, and they were able to tolerate. So as of 4th of June, the ministry has now proved that for such patients with anaphylaxis, they are able to receive the Pfizer and Moderna vaccine. So that's good news for this group. If you had a reaction to any vaccines before, or you had a reaction to the first dose of the COVID-19 vaccine, unfortunately, at this point in time, you are still not able to receive the vaccine. You are advised to wait for a while, right? Or perhaps look for alternative vaccines per se.
Okay. Thank you, doctor.
Welcome.
I have somewhat, it's not exactly my experience, but my wife's experience, not related to anaphylaxis, but what I'm actually trying to drive at is that, so she actually has a allergy to a particular kind of medication, right? And because she's actually in the medical field, so she was shortlisted as the first batch to actually, go for the vaccination. And then turning up that day, like when you actually shortlisted for the vaccination, when you register, you have to declare, what kind of allergies you have and things like that. So she did all that. She turned out on the vaccination day. Again, the nurse at the vaccination center actually asked her, what are your, do you have any allergies and what are they and things like that. So she told the nurse, and then the nurse actually stopped for a while and went to consult the doctor and told her that, for this particular allergy, although you are here today, right, for Pfizer, she was actually going for the Pfizer one. We won't advise you to actually take it yet. So please hold on. So we actually went back that day. And then after that, I think 1 month later, I think it was sometime in April, then she received another notification that, okay, Pfizer is already approved for your group already with this allergy, so you can actually go and take it now. So I think that's actually quite reassuring from the particular experience that we actually had, whereby we can have all this information online that's actually released in the press, and after all, they are all very general. But what I'm trying to drive at is that this assurance that we actually have at the vaccination center, when they can really go in case by case, and you are still able to actually have the double confirmation before you actually receive the vaccination. So I'm not sure, because it's actually based on our experience alone, whether for everyone, they will actually ask you, which I'm pretty sure that they will, and I think that is actually quite reassuring.
Oh yes, absolutely, yes, yeah. So I share the same sentiments. I mean, I've had patients, again, very common scenario, because the guidelines or the guidance do adjust accordingly. Yeah. So I do have had patients who were initially turned away or advised, to wait for a while, don't get the vaccines first. But I've noticed that, for example, as I mentioned, about 4th of June, the guidelines were revised, and then they allowed those with anaphylaxis to receive the vaccines. And I already received word from some of my patients that where they were previously rejected, now they just got the SMS to say that, okay, you can reapply to take the vaccine. I'm assured by that, because at least our government is keeping track. All right. What has gone out mentioned in the press, they follow up quite closely. And echoing your wife's experience in the vaccination center, I can agree, because same thing, my patients who have come back to me, and I remember a very funny experience where my patient came to me and was a bit concerned because apparently the doctor at the vaccination center spent 20 minutes telling the patient why you should not receive the vaccine. What is an allergy? What is your reaction per se, right? Can I correlate? All right. So I will tell you that the vaccination centers are very careful. For those who have doubts about the vaccination centers or the polyclinics, for example, I will be heartened to say that they are run by very competent staff. See, they do not just assume that what you take in your e-application, your electronic application is the gospel truth. They will still double check, double confirm. So I think for those who have doubts about the centers, another thing is that some patients have asked me how the center safe or not, community center safe or not. I can assure them that it's fully run. All right, the equipment are checked well. They have all the necessary equipment, all right, and they have the necessary beds to look after, the staff to look after, right? Because the staff that run the centers are all actually from established groups, sometimes Raffles, Fullerton, all contribute the staff to run the clinic. So be assured of the safety of these centers.
Yeah. My wife already completed her doses, and then she's
Excellent.
up and running by the second day. I mean, the second day, she just had a bit of a ache on the arm. Then after that, she go for her spinning classes already.
Lucky her, although by right she shouldn't.
Yeah. So yeah, there's this other question I think with regards to allergy and like rashes that Karen Cheng has actually asked. So like I think after the dose, right, they will actually ask you to actually stay back for half an hour just to observe, make sure that everything is actually okay. And yet, people are still like, there are still cases whereby people actually still show like cases of rashes after like a few days. Is it like what is the probability of that? Like, will it actually only show after 24 hours, 48 hours? How is it like?
Very good question. So now the reason why a center or the polyclinic or perhaps the hospital chooses to observe the patient for half an hour is because majority of anaphylactic reactions, that means severe allergic reactions after the vaccines, if you understand the immunology, I would say 99% of these reactions occur in that half an hour, right? So that half an hour observation is crucial. Some patients actually want to run off after receiving the vaccines. We do not advise that. Please stay at the center, all right, for half an hour, right, to just sit down, rest, enjoy the sights, see other people getting tortured, getting the vaccines, all right. It's fine. Just stay there, play with your phone, all right. It's absolutely fine. After half an hour, if there's no problem, proceed to the counter, get your date or get your certificate that you have been vaccinated, and then move on, all right? And the reason is because most severe reactions happen within a half an hour, all right? So far in Singapore, we have had about 21 cases of anaphylaxis, all right? This is about after 2 million doses, all right? This is, again, a very, very low percentage of anaphylaxis. Right, and how they were picked up is because thanks to the good our staff, all right, the patients were observed, they quickly intervened, and although anaphylaxis potentially is life-threatening, none of these patients died. They received appropriate treatment. Now, having said that, vaccines can cause delayed reactions. Right, they can cause delayed reactions, just like any medication, just like any other vaccines. They can cause delayed reactions. What can they include? They can include rashes. I had some patients who had swelling, per se. They can happen later on, anywhere up to 7 days, sometimes a little bit longer later. No problem. If they develop reactions, visit any practitioner, any general practitioner can visit the hospital if they're concerned. We as medical professionals have been strongly advised, all right, actually we have been instructed. The moment I get a patient, I admit a patient or I see a patient with potential allergic reaction, I have to notify the ministry, right, so that they can keep track of all the reactions. And again, I know that they are keeping track because there was one patient who saw me for allergic reaction. I notified at 12:30 p.m. Kudos to them, 1 p.m. I think they put down their lunch and then called me. That's how enthusiastic and serious they are about allergic reactions. All right. So generally, I would say that it can happen, but do not worry. All right. Feel free to seek medical attention. Let the doctor assess. All right, and let them notify the ministry. All right, and we will treat you accordingly.
All right. So I have a question as well. I think some of them it's quite similar to some of the questions that are being asked.
Yep.
It's kind of like a two-part. So it's like, how about people with other medical conditions like diabetic, anemia,
low blood.
Anemia, sorry.
No problem.
Anemia, or other things like people who are going through like medical treatments like high cholesterol, could be diabetic and dialysis, or even chemo. So these are the people who are really going through certain treatments, or also taking medication as well, or even people who are halfway taking their flu vaccination as well. So all this how do you advise them, or should they go for it, or what?
Excellent questions. Okay, so let's touch base upon the chronic conditions first, the common chronic conditions. And I will share with you that it is well established that patients with these chronic conditions, they tend to be in the elderly. All these high blood pressure, high cholesterol, heart disease, stroke, they tend to be in the elderly. And it was very unfortunate that this was the group that actually had more severe disease. Let's see. So they were the ones who, unfortunately, many of them, I wouldn't say many, but some of them had to enter ICU for severe COVID-19 disease. And this was not only in Singapore, but worldwide observation as well.
Yep.
So again, for the Pfizer and Moderna studies, did look at this group. So if you remember that I mentioned about 40,000 patients in the Pfizer study, some of these patients actually had these chronic conditions. The good news is that they actually specifically look at this group, no increased risk from getting the vaccination. In fact, benefits were there. All right. So the benefits clearly outweigh the risk for this group of patients. Now, for cancer patients, you may have, if you have gone through the serial guidance from the ministry, it was true that at one point in time, patients who were on active treatment for cancer were advised to defer their vaccination. Right. Again, thanks to the updated guidance, selected patients can receive the vaccine, but it depends on the treatment because nowadays cancer therapies can be of many types. Correct, can be of many types. So it is best to discuss with their cancer doctor, right? And ask the cancer doctor, Doc, I'm on this treatment now. Can I go for my vaccine? The cancer doctor will be able to consult the ministry. All right, and then advise accordingly.
Okay, thank you for sharing.
Welcome.
So, how about those on just to be add on? Like someone also did ask, how about those on thyroid, thyroid medication as well?
So far, no contraindications from my knowledge. So far, no contraindications.
Okay.
Obviously, please ensure that the thyroid condition itself is well controlled. I think that's important. Just like I'm biased because I'm a lung doctor. So if my patient has got pneumonia now, has got asthma attack now, or my smoker's lung attack now, I would advise them treat that problem first. Make sure that you are well treated first, stabilize the condition, then go for the vaccine.
Understand. Thank you, doctor.
Welcome.
Okay. Then next question will be, I see here is from Hannah. So let's say, those of us may actually have some other vaccines, not COVID-related, COVID-19 vaccines have already planned. Is there like a certain guidance or guideline whereby after a certain number of days after you've taken those vaccines, then only you should actually consider to take the Pfizer or Moderna vaccine?
Right. So generally, no specific guidelines. I give example. If you follow our national immunization program, there are things like the influenza vaccine, pneumonia jab. For ladies, there's the HPV vaccine, for hepatitis vaccine as well. So there's no major guidelines now to say that there must be a specific interval between receiving this vaccine and followed by the next vaccine per se. But it does make sense that, if you have, let's say I give an example, if you had a flu jab previously and you had about 2-3 days of symptoms from the flu jab previously, there are some minority who do get that, then it wouldn't be advisable to go so soon. I mean, again, I would like to highlight that it is best to control whatever symptoms you have. Make sure you are symptom-free, or at least not too stressed by anything before you go for your vaccine. All right, so that's the general advice.
Oh, okay.
Great.
Maybe this is actually a bit strange to ask, but like
no problem.
When you mention being stress free and things like that, so is there like some kind of a diet or lifestyle that one can recommend prior to taking those vaccines to actually minimize those chances of getting the side effects?
I wish there was. I
So
wish there
there's no in
was.
particular.
I wish there was.
Also can
Give me 2 days of give me 2 days of MC rest first before I take the vaccine. Unfortunately, there isn't. There isn't.
Okay, so
I think it's
so nothing
just carry on
official.
with life. Yeah, as long as you don't do anything too strenuous. All right, don't stress yourself, because you'll be where you can sleep. All right, but what happens is that sometimes you'll be surprised when you're stressed. Everything it puts after all, the vaccine is to sort of stimulate your immune system. So you think about it, if you actually get too stressed, the immune system is also placed under stress per se. All right, it's something beyond the normal what the immune system can normally cope with. All right, then perhaps it may not do you that well, although there's no good evidence, there's no direct evidence say that this amount of stress plus this vaccine means that you're more likely to get side effects. There isn't, but I think it would be common sense to find a time when you're not too stressed, to receive the vaccine per se.
Understand. So I have this question that one of the audience is asking, because there's also a group of people who are in the audience that are also parents who have kids that are under 12. So is there any clinical trials for vaccines for people who are for kids, children under 12 that they should be looking at?
Yes, there are. So as we are speaking, Pfizer is actually doing a study for children below 12. Right. So keep a lookout for that. I'm sure that the data will be published because it is unfortunate. I think again you may have come across some news that in the recent times, especially with the newer variants, it seems that children have a higher risk of more severe disease. So to quote some evidence from USA, they noticed that those for children and teenagers who were hospitalized, about 1/3 of them actually needed ICU care. Wow. All right, that is a worrisome statistic for us, and that's why if you can see now the rationale why the government has shifted the focus, especially in the past 1-2 months, to say that can we get our children vaccinated? Yes, because we really don't want to prevent that dreaded scenario from happening.
Definitely. Thank you, doctor. So how about those with sorry, I want to ask my food question related one. So seafood can eat, right? Like what I eat a lot of things. I eat all sorts of things. So
you mean after taking the vaccination?
Yeah, after taking vaccination. So should I avoid seafood? Maybe if for those who are even I got not me, but if I got heartburn, like acid reflux, all this is no issue with the vaccine, right?
Okay, so I guess just to clarify your question is, let's say if you have a history of heartburn per se, right, that should be fine. That should be fine. Obviously, I know sometimes you want to pamper yourself after the vaccine by having a heavy food meal. But at the end of the day, I think just remember that we hope not to confound any symptoms, all right, during the time after the vaccine, because let's say you do get symptoms after the vaccine, right? And you come to us as the physicians, for assessment. Ideally, we would like to discern, okay, is this an allergic reaction or is this not an allergic reaction? Because for the physicians, all right, we have to be very careful, because if we say that this is an allergic reaction per se, right, then there are implications. You may not be able to receive further doses of the vaccine. Right, so that's why we always say after you get the vaccine, okay, treat your symptoms. If it's side effects, okay, take Panadol. Okay, don't need to suffer. Right, take Panadol, control the symptom. You want to take MC? Okay lah, you discuss with your boss lah. All right, because sometimes you really can't. That 1-2 days you really feel a bit feverish or chills. Also not good. All right, you don't want to stress yourself too much further. Right, so that's one thing. Now, if you get allergic reactions, on the other hand, again, likewise, we don't want to confound anything. So, if let's say you're known to have mild allergy to seafood, for example, all right, before then, please don't go and take seafood after the vaccine, because that really
it could trigger.
It could trigger, and then we are all worried for the next dose.
That's true.
That's true. Thank you.
Yeah, so basically, I think most of the cases for the side effects are after the second jab, right? Is just curious, is it any particular reason why, or because I think one of your slides there was you actually stated there was this total amount of those for Pfizer as well as Moderna, right? For for the dosage. But is there a difference in, like I was thinking, is it because like the first dose is like a certain amount and then the second dose is actually larger, and then that's why like the side effects actually more common after the second jab for most?
Actually, no. The doses between the, let's say, Pfizer 2 doses or Moderna 2 doses, the doses are actually the same.
Oh,
Actually the same. Yeah, there's no difference. Perhaps one hypothesis is that this is again something unique about the immune system. When it recognizes something that's foreign, more often than not, it's the second time that it mounts a stronger immune response, because the body says, this is something foreign. Okay, I will respond stronger to it. I remember last time it was foreign. Now again, it's coming into me. All right, I respond stronger to it. Okay, so that's some of the that's a little bit of the basic immunology behind a vaccine per se. All right. Having said that, having seen quite a fair number of patients with side effects from COVID-19 vaccines, I can share with you that it's not a hard and fast rule that the second dose causes more reactions. I have seen patients where the first dose actually caused more reactions, and then the second dose they were absolutely fine per se. Yeah, so I can give my personal experience. My dad, he had the first dose, he had actually quite bad giddiness per se.
Oh, okay.
Yeah, but second dose, he was absolutely fine.
Oh, okay.
Yeah, I was quite surprised also, because I was prepared that the second dose he would be more giddy. I need to stand by medicate. Yeah. He's retired, but I needed to stand by medicines for his giddiness. Surprisingly enough, he didn't. So I think it varies from individual to individual. If you get reactions during the first dose, all right, perhaps, yes, it's a marker for your reaction during the second dose, and you may want to take some precautions, all right? So if you get a bit of that you're going to get, that you have chills, fever, you want to take Panadol the second time around, just to prepare, just to be on the safe side, or standby Panadol.
Understand.
I see. All right, next question from Ivy Lee, right? So she took her second Pfizer shot and her blood pressure actually shot up to, I think, close to about 140. And then, I guess the question is there a correlation between like taking a jab and, with blood pressure?
Okay, so good question. So many a times when you go for the vaccine, you kanchiong lah, it's like kanchiong. So your blood pressure naturally goes up a little bit per se. So at the time of checking, if it's about 140 is what we consider high, slightly high. It is considered at the point where it just reached high blood pressure, right? The marker per se. But again, it's under a circumstance where you feel kanchiong, your body is under stress, all right? So usually I would recommend to my patients, okay, one-off 140, not the worst kind of high blood pressure, all right? And there's a confounder, there's something else that potentially can affect the blood pressure. No worries. Go through the vaccine first. It is safe. You can still go for your vaccine. After that, once you are well rested, few days or few weeks later, have another blood pressure check. Have another blood pressure check. If the blood pressure is still high, then perhaps this could be a marker of a newly diagnosed high blood pressure. But if, let's say, the next time around your blood pressure is entirely normal, okay, then it's unlikely. And then you can continue to monitor thereafter.
I see.
Right.
And let's see.
Okay, I think this one very interesting. You talked about
Sure.
I cannot find the question, but I remember it very clearly. You talk about pregnancy for women, right? Like
men. No.
I'm pregnant already. Don't worry. I know I'm pregnant for very long already. Don't want to kill my baby, so I'm okay. I know it's fine. But we talk about fertility earlier on, about like for women who are for couples who are trying, especially females and those who are pregnant. But how about men?
Yes.
So this question I saw is very interesting. Someone asked, does it affect the fertility in men for those who take vaccine?
I do not have any evidence of that, or nor has there been any advisory coming up from CDC. CDC is basically the US main body, or WHO, about concerns about fertility in men per se. So I think please carry on. continue to improve the birth rates in Singaporeans.
Oh,
All right, please carry on and then protect yourself, get vaccinated as well.
Can.
Next question will be from Erin Lee. She asked if one can actually take, like, let's say, for example, two completely different vaccines. Like, first, you take the Pfizer, and then second one, another one. Like, is there a current guideline whereby right now you have to take two doses, like, which is from the same vaccine?
Very, very, very good question. All right. So essentially, all along, obviously, if I'm Pfizer, I will tell you to take Pfizer vaccine now. All right, both times.
Yeah.
Having said that, I think there are circumstances across the world, all right, where perhaps there may be shortages of a certain vaccine. All right, and there have been countries who have tried giving perhaps the first dose vaccine A, and then the second dose vaccine B, per se. Or perhaps the patient had received vaccine A, got allergic, realized that had an allergic reaction to vaccine A, so now they need to think about vaccine B. All right. So there have been such situations that arose before. It's very, very, very early data. All right. And there's definitely not a full clinical study, but the early data shows that it is possible. Right. That means those that get vaccinated with vaccine A and then followed by vaccine B, no major harm, right, per se. And generally, you may mount a stronger immune response. We still don't know why that is the case. But overall, it does seem that it is an option that can be explored in future if the need arises. Now, I roughly looked through the question. I saw there's one was that if I get vaccinated with Pfizer, can I get vaccinated with Sinovac? Now, that one really no knowledge, because if you get vaccinated with an mRNA vaccine, what the early study showed was that they did it with vaccine B was also an mRNA vaccine, per se. Obviously, Sinovac, again, for common knowledge, is not mRNA vaccine. It is an inactivated virus vaccine. For that, we really don't have any data, all right, per se. So to get vaccinated, let's say with a different type of vaccine or different form of vaccine, really needs to discuss the benefits and risks with the patient. And we will still have to await more data for that.
Right. I guess, that one we will just have to actually keep ourselves updated to.
Yes, correct.
Yeah. Updates.
Yeah.
Makes sense. Next question will actually be from Angeline. She mentioned that she has NSAIDs.
NSAIDs.
Yes, correct.
Yes.
NSAIDs. I personally do not know what it is, but if I'm not wrong, it's something to do with a drug allergy, right?
Yes, it is. So NSAIDs are this family of medications such as aspirin, Brufen, Bonstan. The long name is basically non-steroidal anti-inflammatory drugs.
Right.
And so, the question was,
yeah. So her question is that she could actually take the vaccine, but her friends were being turned away for some reason. I guess the question is that, are there any situations whereby someone who actually has this allergy would be advised not to take it?
Yeah. So NSAIDs induce eye swelling. Interestingly, was actually one of the, up to March 2021, was actually one of the criteria where the patient had to defer the vaccine. I think that was because of the initial concerns, because it's a very common allergy per se. So if let's say that person had applied for the vaccine before March 2021, they would probably have been rejected. The good news is that since March, that criteria has been removed, and patients with NSAID allergy, all right, can receive the vaccine.
Okay.
Cool. Thanks, Angeline, for that question. The next one would be, this is something I would like to find out as well. I think many of us would also like to find out. With regards to annual health screening. So let's say, for example, I've already scheduled both my annual health screening next month. I'm thinking to actually take the vaccine soon. So is there a time frame whereby after I take the vaccine, should I postpone it to a later date for my health screening, or can I go for my health screening as per plan?
I would not. I think that the same thing. If within 1-2 days of going for the vaccine, then you go for a health screening. Probably not advisable, all right? But to my knowledge, as far as I know, most health screening packages are very general, all right? They just do your simple blood count, kidney checks, liver checks, all right? The vaccines definitely don't cause significant abnormalities in this blood tests per se or urine screen. So please proceed on, all right? Do not let the vaccination disrupt your schedule too much, all right? I support going for health screening.
Yep.
That's good to know.
So I saw this question, which actually early on you actually mentioned as well. Doctor, you said, so this person he said that he had an allergic reaction to Pfizer's vaccine and was actually recently offered the Sinovac vaccine, but he also worried about like adverse effect. So in this kind of situation, right, is there any advice is there like?
Good question. So the Sinovac at this point in time is going to be offered via a special access route. So it's not in the national immunization program.
Yep.
The Sinovac will be offered at private clinics. The ministry has not announced which clinics yet.
Yep.
And along the time when this special access route is available, I'm certain that the ministry will release the data and the side effect profile for Sinovac, so that when the patient comes for counseling and informed consent, the physician is able to share the side effect profile, safety, efficacy details in comparison with Pfizer, for example, or Moderna. So let's wait for that. Watch the space. All right. We will await more news from that.
Yeah, because because I just want to follow up on the question, because there's a few questions of them are saying like, oh, can I take Sinovac? Is the non-RNA vaccines better for those with allergic reactions, those with allergies? And so this is just something that I think a lot of people are actually concerned, like, oh, is it the non-mRNA COVID, which is like the Sinovac kind of vaccine, has lesser side effects as well?
Okay, so again, I think the data is still pending for that. So to just give a brief outline, Sinovac uses an inactivated virus form of technology, which is established technology. It's found, for example, like in the flu jab, the influenza jab, that uses inactivated virus. Nonetheless, Sinovac is a new vaccine, okay, even though it uses established technology. So we need to look at the data and the side effect profile. As mentioned, there's no direct head-to-head comparison between, say, Pfizer versus Sinovac in terms of safety profile. I think what we need to know is that from the manufacturer or from the data that's been published, what is the safety outcomes for those populations that have been vaccinated with Sinovac.
Okay.
I think we are about to actually come to a close soon. Maybe we can actually take like one last question, perhaps.
I have my last question. Actually, it's not any question that is being asked by anyone, but the question is, now with the new trend, with now the new variant, the Indian variant, and so many other variants, right? Does the vaccine still work? So this is what happened. So I received messages. I don't know who sent me, say, because now the variant has changed, or now Sinovac is better than Pfizer. Pfizer is not as good, or Moderna is not as good. Blah 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 blah. So is this like true? Because even during the press release by the task force, right, they're saying that we might even be taking booster shots in the future when everyone is being vaccinated to actually combat the different variants of the COVID-19.
Okay.
So this is my question. So now I've got new variant, right? Should I just wait it out? I wait for maybe a few months later when the government now got new variant, I can use this booster shot. Or
wait for version 10.
Version 3 or version 2. Like iPhone update. Wait for the update, then I go and take.
Anyway, iPhone cannot buy everyone. Cannot buy every version. Vaccine, no choice. Vaccine, you have to update as according to the advisory by government. Okay, so anyway, jokes aside. So I think there's two parts to the question here. Why and I actually want to clarify one question I saw earlier about why is there a need for a second dose? That's actually a very good question. All right. So the reason is because one dose, the protection not enough. Not bad. Okay. So looking at Pfizer, they looked at the protection, all right, the efficacy. One dose was about 60 to 70%. That's not too bad. But it can be better. If you can get 95% efficacy, I think why not? All right, why leave it to chance per se? Now, in terms of a booster, right? Actually, the reason for booster is not 100% due to maybe new variants or something like that. It's really because there is some concerns that as time passes by, your immunity wanes. Your immunity gets weaker. So just like flu injection, all right, or what we call booster, it is good to go for updates. And then, by the way, I'm sure again, these vaccine companies, they don't just stand still. They don't just sit and say, oh, let's just use this vaccine version 1 throughout. All right. These companies are continuously surveying, are continuously updating their vaccines, keeping an eye out for the variants. All right. But because nowadays with globalization, the moment there is a variant, they can study the genetic makeup of the variant very quickly. So, are the vaccines useless against new variants? To be honest, there will still be some protection, right? In my opinion, there will still be some protection. It is not entirely useless. And I would say that out there is no data to suggest that Sinovac is more efficacious against, say, the new variants versus Moderna. After all, both were designed at a time, right, when they were all designed last year. There's no difference in the time of this. It's just a different technology per se. However, as responsible vaccination companies, I'm sure that they will, all right, survey the different variants, update their vaccines, and if necessary, they will announce that they will need to update the vaccination status for patients accordingly. So keep a lookout for that.
Thank you, Doctor.
See. All right, guys. With that, I think it's a good time that we come to a close. It's been a really, really, absolutely insightful afternoon with Dr. Chan. I think he actually took a lot of time to actually prepare all the slides and really, as you heard from him earlier on, he actually went through all the information, all the digging and things like that, really just to give his all during this afternoon. So I think it really helped us to actually put us, much more at ease as our vaccination draw nearer. So we really appreciate your sharing with us, Dr. Chan.
Thank you, Doctor.
Will do. Thank you very much.
Yeah. Also, huge thanks to Leslie for joining in along this session. And he was telling me that he has some great lobangs to actually share with you guys. So Leslie, what do we have for the audience?
So before we end the session, right, there's actually 4 things, lobangs that I want to share with you guys. So you guys have actually mentioned, like, you're worried about side effects as well. So actually, MOH has this program that it's being set up to actually provide a one-time financial assistance for people who actually suffer or experience serious side effects related to the COVID vaccine. Of course, and that's one. The second one, that if you're worried about, getting to the vaccination center from your home and also as well as getting back home, you can use a Gojek. So Gojek is actually giving away 2 times $15 voucher. They will be sent to your phone. You can check under the voucher site, so you don't have to worry about getting there and coming back. You can use that to get to the vaccine center as well. Thirdly, from my company Prudential, we are actually providing a complimentary coverage that protects you financially for the side effects of COVID-19 vaccination. If you are keen on finding out more, just all you need to do is to indicate in the feedback form that will be sending out later, and they will send you the instructions. And of course, lastly, like what the doctor has said, it's recommended that you should rest after the jab. So those who have attended today, we'll be giving a $10 GrabFood voucher so that you can order in after the vaccine, rest at home and make sure you recover, rest well, and so that for the vaccine. Yeah.
All right. Thanks, Leslie. Yes, as Leslie mentioned, there's actually going to be a $10 GrabFood voucher that y'all can actually have for the next meal order. So give me a moment as I actually going to be sharing the screen. Yeah.
So I can't thank enough for Dr. Adrian to take out time to really answer all our questions, all my random questions as well.
Yeah. So you guys just need to actually take a second to actually scan the QR code. Remember to put down your email address in the form, and then we'll actually send you the voucher within the next 2 weeks. Okay. So I'll leave the QR code on as we actually take our leave. So once again, thank you all to actually stay out throughout this 1 hour and 15 minutes session with us. on this Saturday afternoon. We from Workwell really, appreciate your attendance today, and we actually wish that as we actually go about and take our vaccines, we'll continue to actually stay healthy as well. All right. Please continue to stay safe and healthy. Enjoy the weekend. Thank you so much, everyone. Thank you, Dr. Chan, again. Thanks,
Dr. Chan.
Leslie.
Thank you, Kai, for having
Thank you.
me.
Bye-bye.
Bye.